Heart disease is a term covering any disorder of the heart. Unlike cardiovascular disease, which describes problems with the blood vessels and circulatory system, as well as the heart disease refers to issues and deformities in the heart itself. According to the Centers for Disease Control, CDC, heart disease is the leading cause of death in the United Kingdom, United States, Canada, and Australia. 1 in every 4 deaths in the US occurs as a result of heart disease. There are many types of heart disease that affect different parts of the organ and occur in different ways. Congenital heart disease. This is a general term for some deformities of the heart that have been present since birth. Examples include septal defects. There is a hole between the 2 chambers of the heart. Obstruction defects. The flow of blood through various chambers of the heart is partially or totally blocked. Cyanotic heart disease. A defect in the heart that causes a shortage of oxygen around the body. Arrhythmia. Arrhythmia is an irregular heartbeat. There are several ways in which a heartbeat can lose its regular rhythm. These include tachycardia, when the heart beats too fast. Bradycardia, when the heart beats too slowly. Premature ventricular contractions, or additional abnormal beats. Fibrillation, when the heartbeat is irregular. Arrhythmias occur when the electrical impulses in the heart that coordinate the heartbeat do not work properly. These make the heart beat in a way it should not, whether that be too fast, too slow, or too erratically. Irregular heartbeats are common, and all people experience them. They feel like a fluttering or a racing heartbeat. However, when they change too much or occur because of a damaged or weak heart, they need to be taken more seriously and treated. Arrhythmias can become fatal. Coronary artery disease. Coronary arteries supply the heart muscles with nutrients and oxygen by circulating blood. Coronary arteries can become diseased or damaged, usually because of plaque deposits that contain cholesterol. Plaque buildup narrows the coronary arteries, and this causes the heart to receive less oxygen and nutrients. Dilated cardiomyopathy. The heart chambers become dilated as a result of heart muscle weakness and cannot pump blood properly. The most common reason is that not enough oxygen reaches the heart muscle due to coronary artery disease. This usually affects the left ventricle. Myocardial infarction. This is known as a heart attack. Cardiac infarction and coronary thrombosis, an interrupted blood flow, damages or destroys part of the heart muscle. This is usually caused by a blood clot that develops in one of the coronary arteries and can also occur if an artery suddenly narrows or spasms. Heart failure, also known as congestive heart failure. Heart failure occurs when the heart does not pump blood around the body efficiently. The left or right side of the heart might be affected. The left or right side of the heart might be affected. Rarely both sides are. Coronary artery disease or high blood pressure can, over time, leave the heart too stiff or weak to fill and pump properly. Hypertrophic cardiomyopathy. This is a genetic disorder in which the wall of the left ventricle thickens, making it harder for blood to be pumped out of the heart. This is the leading cause of sudden death in athletes. A parent with hypertrophic cardiomyopathy has a 50% chance of passing the disorder on to their children. Mitral regurgitation, also known as mitral valve regurgitation, mitral insufficiency, or mitral incompetence. This occurs when the mitral valve in the heart does not close tightly enough. This allows blood to flow back into the heart when it should leave. As a result, blood cannot move through the heart or body efficiently. People with this type of heart condition often feel tired and out of breath. Mitral valve prolapses. The valve between the left atrium and the left ventricle does not fully close. It bulges upwards or back into the atrium. In most people, the condition is not life-threatening, and no treatment is required. Some people, especially if the condition is marked by mitral regurgitation, may require treatment. Pulmonary stenosis. It becomes hard for the heart to pump blood from the right ventricle into the pulmonary artery because the pulmonary valve is too tight. The right ventricle has to work harder to overcome the obstruction. An infant with severe stenosis can turn blue. Older children will generally have no symptoms. Treatment is needed if the pressure in the right ventricle is too high, and a balloon valvuloplasty or open heart surgery may be performed to clear an obstruction. Symptoms. The symptoms of heart disease depend on which condition is affecting an individual. However, common symptoms include chest pain, breathlessness, and heart palpitations. The chest pain common to many types of heart disease is known as angina or angina pectoris and occurs when part of the heart does not receive enough oxygen. Angina can be triggered by stressful events or physical exertion and normally lasts under 10 minutes. Heart attacks can occur as a result of different types of heart disease. The signs of heart attack are similar to angina, except that they occur during rest and tend to be more severe. The symptoms of the heart attack can sometimes resemble indigestion, heartburn, and a stomachache can occur, as well as a heavy feeling in the chest. Other symptoms of the heart attack include a pain that travels through the body, for example, from the chest to the arms, neck, back, abdomen, or jaw. Lightheadedness and dizzy sensations, profuse sweating, nausea, and vomiting. Heart failure is also an outcome of heart disease, and breathlessness can occur when the heart becomes too weak to circulate blood. Some heart conditions occur with no symptoms at all, especially in older adults and individuals with diabetes. The term congenital heart disease covers a range of conditions, but the general symptoms include sweating, high levels of fatigue, fast heartbeat and breathing, breathlessness, chest pain, a blue tint to the skin, clubbed fingernails. In several cases, symptoms can occur from birth. However, these symptoms might not develop until the person is older than 13 years.
Thanks for watching. Make sure to subscribe to this channel and click the bell icon for our notifications at your fingertips.